Let's learn an easy mnemonic to remember the signs and symptoms of increased intracranial pressure. It's called mind crush. Each letter stands for one key clue your patient might show when pressure inside the skull starts to rise. M stands for mental status changes. This is the first and most sensitive sign. When brain pressure increases, blood flow drops and oxygen decreases. The patient becomes confused, restless, irritable, or unusually drowsy. It's the brain's way of saying, I'm not getting enough oxygen. I stands for irregular breathing. As pressure pushes on the brainstem, breathing patterns become uneven or Cheyne-Stokes-like, deep, shallow, then pauses. It's a serious late sign. N is for nausea and projectile vomiting. The vomiting center in the medulla is directly irritated by the raised pressure, so it happens suddenly, without warning or nausea beforehand. D means decreased pulse and increased blood pressure. This is the body's last attempt to push blood to the brain. It's part of Cushing's triad and a critical warning sign. C reminds you of cranial nerve dysfunction, especially the third cranial nerve. You may notice unequal pupils or sluggish eye movement because the nerve is being compressed. R stands for reaction to light, becomes sluggish. When you shine a light, the pupils take longer to constrict. Another subtle but vital neurological clue. U is for unconsciousness. This is a late and life-threatening sign. When cerebral perfusion drops too low, the patient loses consciousness as brain tissue becomes starved of oxygen. S represents seizures. Swollen hypoxic brain cells begin to misfire, causing uncontrolled electrical activity. Sometimes mild twitching, sometimes full convulsions. And finally, H is for headache. It's usually dull, worse in the morning or when lying flat because venous drainage slows down, increasing pressure and pain. So remember, mind crush, the complete mnemonic, to help you recognize rising intracranial pressure early and act fast before it becomes fatal.